What is up, guys? As you can see, a little bit has changed. My hair is now twisted up. I'm about to start doing dreads. I had dreads before, but my hair texture is like just so soft, so it kind of really didn't work. This shit is gonna annoy the out of me, bro. Like, you don't even know. But catch me like next year, these shits is gonna be like, you feel me? Anyway, top surgery. I started looking for a top surgeon in 2017. I went to this one doctor that I found who really had specialized in trans surgeries, and I was about probably 7 to 8 months on T. I wasn't 18 yet, so we talked about the different possible top surgeries that you could have. The first top surgery that we talked about was keyhole. Some of you who aren't trans probably don't know what that is. So basically, keyhole is where your chest is already small enough where they could just pretty much go under the nipple and then just take out the excess. So you're left with like minimal scarring. The doctor that I went to the first time was specializing in that, so I had a feeling off the bat that she already wanted to do that. Yeah, I was prepared to have a double mastectomy, but she thought that I felt in between the lines of both, so that I wasn't too big for keyhole, but I wasn't too small for double mastectomy. Now, me personally, looking at my own chest, like, I really thought that double mastectomy was the only way. If I would have gotten keyhole and my chest would have been too big, like, first of all, my nipple size would have been like way too big, and I would have had a bunch of excess skin that I would have had to go through another surgery for. Before we could even get into what type of surgery I was gonna have, I had to wait until I was 18. So I came back Thanksgiving break and she told me that I needed letters. So now I was supposed to go back to my counselor, my endocrinologist who gives me hormones, and my psychiatrist who initially wrote the letter for me to get hormones. So I finally got the letters in 2018 at the beginning. And I went to go have another consult with her, and this is the consult that we're like, hey, we're gonna like schedule the surgery now. I told her that my mom was moving and that I was possibly gonna be getting another insurance. I told her that I was probably gonna get Medicaid, and you know, it turns out she didn't cover Medicaid. So I had to wait until the summer until I was able to get the insurance that I was gonna have. And then once I got that insurance, I started calling up places and being like, hey, like, I'm looking for a plastic surgeon that specializes in chest reduction. Can you give me a list of options? I just went off of a limb and they gave me 3 doctors. When I first got to this surgeon, I was kind of nervous because she had only had experience with like 3 other trans people. Not really though, cause I mean, of course she did, you know, like breast cancer patients, but it made me feel better knowing that we were in the same headspace for a double mastectomy. After we had our consult, she scheduled me a couple months out. I ended up having surgery July 26th. Before I went to surgery, I decided that I wanted to work out so that I could get the best results. So I worked out and I got pretty big. So here's a picture of me when I was working out. I just like working out to a point where people notice that I go to the gym. Like, you could say like, hey, you been going to the gym. You're like, you know what I'm saying? Okay. Top surgery was like one of my first surgeries ever. Also, I didn't mention, when you get those letters, the letters are really for your insurance to say like, hey, this is like medical because you've been diagnosed with dysphoria, which is, you know, actually like, I guess considered a mental disorder now. But if I didn't have those letters and stuff, they would have considered it cosmetic and I would have had to come out of pocket. A lot of people were nervous for me. My family really didn't want me to have it, of course. I had waited a long time and I had been binding for a long time. Unlike bottom surgery, top surgery is something that affected me on a daily basis. Binding all that time was very hard on me and very hard on my body, I really wanted to do that as soon as possible. I just hated the fact that the binder was so tangible and that I couldn't really leave the house without it. I couldn't be around anybody without it. I was super embarrassed, like even being at home. When I first got there, my mom wasn't here, so neither of my parents live in New York at the time. I was alone. This was my first year of just being just me and my grandma's, and yeah, I was still in school at the time, so I was only staying here for the summers, really. My mom's mom was the one who took me to the hospital, and her reaction, Jesus Christ. When we got to the hospital, we was literally pulling up and she was like, "Are you still ready to get the surgery? Why are you asking me if I'm gonna change my mind like 2 hours before surgery?" If I was gonna change my mind, I would have been changing my mind by now. My mom was pissed, bro. My mom was pissed because I checked in and everything. And once I checked in, like my grandma just left, bro. She just left the hospital. Like I had to go under everything by myself. You know, I wasn't scared of it or nothing because I'm just already naturally a really independent person. When I first went in, they had to like draw on my chest and everything. And then they gave me some type of shit in my IV to like kind of take my anxiety away. I just felt like really loose and stuff. And like I started joking with the doctors. This was by the time they was like wheeling me in. I woke up just like really groggy. My chest was tight, but like as soon as I woke up, I could tell that, you know, a weight had been lifted from my chest. Ha ha ha. Yeah, I could already tell it was lighter and everything when I woke up. My grandma eventually came back for me. I ended up staying with that grandma for a while because my other grandma, she like still works full time. Why? I don't know. She's like 66 or something. No, I lied. She's like 68. Still working. So, ugh. I couldn't really do much of anything the whole time. I really could only just hold my cell phone. I had to lay on my back, which is very hard for me because I can't really sleep on my back. I remember the first night, I accidentally in my sleep rolled over onto my side, and I'm sorry, I forgot to mention. So once you come out of surgery, they have these things called drains. So they have like little tubes in the side. The fluid, like excess fluid, can drain out, like, you know, blood and stuff. I had 2 of those coming out. There were like little balls like on the end where the fluid would collect, and I would have to like dump them and document how much was in there. The doctor would want to know when you go back for the checkup, and if you still have a lot of fluid, you keep them in. If you don't have that much, they take them out. I had those for like maybe 4 days, 4 or 5 days. It wasn't a full week, I remember. I was healing pretty quickly, but I think the reason why I healed so quickly was because I'm like very healthy. I'm a vegetarian, and that summer I was like even part vegan at one point. I tried to be vegan that summer. It was really hard because I worked at McDonald's. I was on a lot of different meds. I'm pretty sure I was on Perk. I was on Oxy. It didn't really do much for me, surprisingly. Like, I thought, you know, people get addicted to that stuff, but like sometimes I would take it and I wouldn't really feel anything. So, I mean, maybe that's the point, to be like numb. I went back to the doctor in those 4 days, and then when it was time to take out the drain, a lot of trans guys say that it's like painful. Some of the risks that you get with the surgery is not being able to feel. A lot of that time, I wasn't really able to feel it anyway. It kind of just felt like really weird. The drain was like really long, like it's like real, like it was long, and she had to like pull it out quick. That shit was like, oof, like it just make you like, what's the word I'm looking for? Cringe. I really couldn't do nothing. I couldn't drive. I could barely open the car door. After 2 weeks, I started getting more range. Like, so I started doing like this, you know. She told me to do something where like basically I put my hand on the wall and I kind of like crawl my arms up. So like, you know, see how far I could go, not really push myself too much. But I would say about after like 2 weeks, I was back to being on my own. I was able to cook. I still wasn't lifting heavy, of course. I didn't really go back to the gym for like, I would say like 3 months. I stayed out of the gym. And you know, any of you college people, you go back to school normally like the last week in August. I thought I was gonna be able to go back to work, but I couldn't. So I really stayed out of work for the rest of the summer. It kind of sucked because I was unemployed for most of the summer looking for a job anyway. Then I finally found a McDonald's job. I worked there for like a month and then I had to come out. It was a hard summer, it really was. Like, especially being without my mom, who I lived with my whole life, you know, that was a pretty big adjustment and everything. And I was actually going through my name change too. I'm gonna do a video on that, how to change your name. Your gender marker, I just changed that though, so you know, I'm gonna do a video on that too. I was kind of mad because when I first came out of surgery, they put like a binder on you, so they put the hospital binder on you. It's like real long. It's like probably like a shirt. It was like a shirt, to be honest. And you gotta wear that for like a long time. So even after she like unwrapped me and I was able to see my new chest and everything, like I still had to wear the binder and I had to wear like pads like on the nipple part. Oh yeah, how did I forget? I almost lost a nipple. One time, I would say probably like a week and a half, because I went to go see her probably like every few days, to be honest, when I first got surgery. My right one, I think, she had took off because it was something, here, I'll put a picture. So this is what it looked like. It was, I don't know what that is actually. It's just something that they put on you. And she was taking it off and like, part of my nipple just fell off. Eventually I was gaining back feeling, but I couldn't feel like most of my chest at first. I still have areas on my chest where I can't feel like really where the scar's at. She had to sew that back up. Before she did, she took like a huge ass needle just to make sure I couldn't feel it and like stuck it in my chest. She had to sew it back up because that shit almost came off. That shit was scary. What they do is they cut in the middle. They make 2 cuts in the middle and they take that big flap off. So your nipple is on that part. So they take the nipple off and they'll take that skin off and then they'll like sew it together and then they'll reattach the nipple. I didn't think that I was gonna be able to feel my nipple after it was taken off and everything because it lost the blood supply. There are areas on my nipple. They're definitely less sensitive, but I can still feel it. You guys seen the picture of my nipples at first with the color and everything. That color came off. It was supposed to come off, I guess, and it didn't really come back all the way. That was one of the risks with the surgery. I don't really know a lot of guys who had problems with that. I just happened to be one of them. I'm not complaining because I really like the results anyway, and color is something that I could easily, you know, get tattooed in and filled in. Yeah, so that's really it. It's always nice talking to y'all. I'll be back with video 6. I'll probably talk about my second surgery that I've had and the introduction to bottom surgery because I'm already in the process of that. So stay tuned, stick around for that, and I'll catch you guys later. Peace.